As Nicole was saying, I'm a pediatrician, but I'm also a parent to a child with Dravet. My son is a boy, and he's still not a teenager. But as a Dravet parent, you're always reading anything that gets into your hand. So I read boys, girls, everything. Okay, all right. So I want to congratulate you for welcome to the teenage years. It's very stressful for any parent, to start, having a teenager. But as parents with a child with Dravet, obviously the stress and the anxiety is greater. So another roller coaster. Okay. So the objectives that we're going to talk today about in our talk is basically we're going to talk about health problems common in Dravet teenagers. We're going to describe anticipatory guidance and health supervision needs, which is what anytime you bring your child or your teenager to a primary care physician, that's what they're going to focus on. And this is going to be specific for adolescent girls with Dravet. Also, we want to talk about how to improve hygiene through the use of visual schedules and newer alternatives, and illustrate and talk about body changes and the menstrual cycle and puberty, and differentiate methods of period management, non-hormonal and hormonal treatments. So health problems in the Dravet teen, pretty much the same problems you've probably been hearing about all day long. Behavior issues, the movement and balance issues, growth and nutrition, sleeping difficulties, respiratory infections, dental problems, and problems with the autonomic nervous system. But now you have a teenager, so it's different. When we're talking about movement and balance issues, the crouch gait is something that we see common in kids and teenagers and adults with Dravet. Basically, if you notice, this is the normal gait, and this here is the gait where you see the knees are flexed, so they're bent, and the hip is also bent, and then they're going to have, their ankles are going to be twisted inwardly. So that's the crouch gait. And basically you see the adolescent walking in a stooped posture, in a stooped position. Not all Dravet teens are going to have it, but it's about 50% or more can have it. Scoliosis is another important important parameter that the primary care is going to evaluate. So basically the curvature of the spine, and here we see how it's curved. All right, so anticipatory guidance and health supervision. So when your primary care is going to see your teenager, it's going to look for acne, hair growth, hair growing in the regular places it should be growing, or growth, abnormal hair growth, gum problems. So these could be because of the medicines that our kids are taking. Also, it's going to check the thyroid, scoliosis, see how they're walking. Any sleep problems such as sleep apnea. Are they stopping to breathe when they're sleeping? How is their growth? Are they growing appropriately? Are they wearing a diaper or not? Are they, how's the bowel or bladder continence? In diet and exercise, we're going to see calcium, vitamin D, and iron intake. And that's, this is the regular teenager visit. So you're also going to do it for a child with Dravet. The medicines that our kids take, the anticonvulsants, tend to lower the calcium and vitamin D levels. So this is going to be very important for your pediatrician or your primary care doctor to monitor this in your child, okay? As in any regular teenager, drugs, alcohol, smoking, and it all depends on the developmental level as well. As your child in any of these. Vaccines, as pediatricians, we're always trying to catch up our kids on vaccines. So the typical vaccines that we give teenagers are the tetanus, diphtheria, and pertussis booster, the meningitis shot, the human papillomavirus, which is the cervical cancer shot, which everybody mentions, and influenza, which is a flu shot yearly, okay? You also evaluate what specialists is your child going to. Neurologist, ortho, genetics, the psych doctor, renal, the eye doctor, endocrine, heart doctor, ENT, psychologist, and all the therapies that we take our kids to. All right, so this is something that we like to talk about, safety. So is your child wearing a helmet or a headband? Depends on the amount of seizures your child is having. They might need to wear a helmet. Some girls do not like the idea of wearing a helmet. So, some companies have come up with a headband. Wait, let me show you. So the ice skaters use this high headband. It's not the same as wearing a helmet, but at least, it's something to think about. Are there safety belts? Medical ID bracelet or shoe tags. So a lot of our kids have possibility of disappearing, or flight risk is what we call it. So, thinking of having your child with a bracelet or a shoe tag, which is not as easily removed as a bracelet. There's also the temporary tattoos, which is the next slide that I'm going to show you. And thinking about technology tracking aids and social media safety. Just for any teenager, you're going to be watching what your kids are looking into social media. The same thing for our Dravet teenagers. So this is basically what I was talking about, the temporary tattoos. So this is the at-home method. Basically, you get a marker, you put liquid Band-Aid right over it, and then, if you're going, somewhere big, somewhere where your child could be lost, this is something that you could do. Because, a lot of our kids are not developmentally aware of their addresses or their phones, so you don't want to lose your child, This is, if you want to spend a little bit more, this company, tattoos.org, actually just has it monogrammed, and you can just put it on your child, and it's temporary. So, in the movie, you'll see, if any of you've seen the movie Finding Dory, it's all about that, okay, about Dory got lost. So, this I thought was a good idea for our kids. So as I was saying, the headband, this is a helmet. It doesn't look like a helmet. So a lot of our teenagers might be, socially aware of using helmets. If they're uncomfortable, there's other alternatives than the usual medical helmets that we're used to seeing. When I was talking about the technology tracking aids and the shoe tags, this is the shoe tag. So it can go over Velcro shoes, or it can go over these type of shoes, and basically it has all the information, allergies, what doctor do you want your child to be taken to, what hospital, what meds. So it's pretty useful, and it's not as easy to take off with some of our kids that might have sensory issues. So it's an idea. These two methods, the buddy tag and the angel sense, this one is a GPS tracking system. Some of the kids, as I was saying, have a lot of sensory issues, so they don't tolerate having anything on. So this, actually, you can put it in the clothing. It's a very cool system, and you get an alert on your smartphone if your child, you can put the parameters. So this is called Angel Sense, and you get text messages if your child crosses a certain area, or if your child goes to an area, you can pretty much know what your child did the whole day. This one also has audio, if you want to hear what your child is, and you can actually talk to your child through it. So this is a pretty interesting system. So just so you know, it's called Angel Sense. The buddy tag is also a very cool one. It tells you the same thing as this one, the out of range alert. This one requires your child to wear like a watch. It's like a watch. They can press buttons, but it's covered, so it's not as easy for our kids to figure out. And you pretty much also personalize it according to your needs. And I like this part about water safety alert. It's waterproof, so if your child is in a body of water, this is going to definitely text you through your smartphone. Okay, so these are different things to think about, because our kids are larger, our kids are, so it's just to be able to track, what they're doing. For returning to the anticipatory guidance, basically you're also going to talk about what, are you happy with where your schools, what your school's doing for your child, how is their progress? Are you thinking about vocational education for your child, if that's even possible? And then at the psychological level, we're going to see, the maturity, what level is your child at? He's a teenager, but he might be, developmentally 1 year old, 2 years old. So it depends on where our children are. Aggression, and challenging behaviors. So this is tricky because we have a large child who's, acting like a 2-year-old. And so it's much more difficult, to handle these. So basically, planning ahead strategies to prevent meltdowns. You know your child. As a parent, your child. You know what's going to trigger. A lot of times you can't predict it all, unfortunately. But a lot of things, what's going to trigger your teenager. And then planning ahead, how is your child going to be soothed if he goes into meltdown? In life skills, you're going to try to focus on helping them self-care, hygiene, and then teaching the difference between public and private behaviors. A lot of our kids aren't socially aware of what's okay to do publicly and what's okay. So, there's visual schedules. So for example, for the encouraging good hygiene, this is to teach your child, how to take a bath, how to shower. So it goes just like when they were younger kids, how to go step by step. And again, it depends on where your child is developmentally, but if it's something that you can work with your child to teach them, then I think it's a good visual. Then this is the one about public and private behaviors, so basically things that shouldn't be done, and our kids do it, my child, I'm always telling him, no, don't do this, don't do that. I go through the same things. My kid's an 8-year-old, but I'm always like, no, we don't do that. We don't talk about that here. That sort of thing. So, underwear on private parts, this. And, so basically it tells you, keeping arms at your side, folding your hands, and teaching them the difference between public and private, So it's a challenge, but there are resources out there to try to help us with this. In sexuality, basically, how is your child even, doing anything, any sexual behaviors? Are you, is there a need for supervision? Is there a need for birth control in your daughter? And what is their knowledge, about, sexuality and what about their own bodies? And unfortunately, our kids are, they're at high risk for abuse because, all their lives they've been taught to follow what adults say. You reward your kids when they listen. So the abuse potential is very high in our children. And if the child developmentally is at an age of an ability to consent to have sexual relations. So that's the other thing. But again, it's individual case, case by case basis, So all this is stuff that you should be talking about with your primary care provider. And basically future planning, it's described, it should start about 11 to 14 years of age is when you should start planning for your child, So, and this is the future planning for adulthood. So guardianship, financial planning. Is your child going to, is your teenager, when he becomes an adult, is she going to be in a group home? Is she going to be able to work in a workshop employment or community supported employment? Insurance coverage and social security benefits, advanced directives and adult medical care. So, all these things are things to think about, and, just to start planning ahead. I mean, I think the advantage of having a teenager with Dravet is that, you don't have an infant and a toddler that's going through, that you don't know what the diagnosis is, you don't know, and you're so overwhelmed by everything. With a teenager, yes, you're going to continue having challenges. You're going to, but you already know a lot of things that you've learned throughout your journey, so it's an advantage, and it's, and we just have to keep trying to see how we make things better for our families and for our children. This is a study that was done in Milan, in the Neurological Institute of Milan, and basically it was talking about the comprehensive care of children with Dravet syndrome. So they followed kids from infancy through adulthood, and they interviewed parents to see what were their concerns, and as you can see, so respite care. So who's going to help us take care of our kids, when we need to do something? So from infancy to adulthood, that was always the worry. Every parent was always worried, regardless if you have an infant or you have an adult, everybody was worried, and this was a common thing. As you can see, seizures, here, infancy and childhood, everybody's very worried about infancy and childhood seizures. And then it decreases. You're obviously never worry-free, because that's just how we are. But you tend to deal with it, I guess, and you at least know what to expect most of the times. This is the cognitive and behavior part. as you see, I think we're so busy with the seizures at this stage that, at this stage we're not really thinking so much about this. But then as the child starts growing, then that's when we start worrying. So obviously this doesn't go for every child, but I'm just explaining to you what this study showed. And then the relationship. See, here we were worried about the relationship, and then what relationship you have with your child, and then this becomes a constant worry after. And then diagnosis. See, we're all worried about diagnosis in infancy and childhood, and then everybody's like, "Oh yeah, I know, it's Dravet." So I thought this was a good slide showing a little bit of everything. At least for this, it was 27 kids followed throughout their lives, and I thought it was pretty relevant to our talk right now. Okay, so now let's talk about puberty. We've talked about all the other things except puberty, so now we're going to start. So puberty equals body changes, okay? So when body changes begin, that's puberty, okay? So depending if your child is verbal or not, trying to teach the correct language, if possible, of body parts. So that's something that you should try to encourage. But as I said, your child may not be emotionally or psychologically mature to be able to do that, and that's okay. Maybe in the future it'll happen. So when do the body changes occur? I know this is the talk about girls, but I wanted you to see what boys, where boys are at. So girls usually between 8 and 12 years old are going to start having the body changes, and it's, they calculate about 10 and a half years is the average, and boys 9 to 14, usually around 11 and a half. As in everything, as all the teenagers, it could happen before, at the same time, or after the typical peers. So you could have a child going into puberty earlier than this age, or having, or at the same time or after, okay? And then with the body changes, you're going to have a growth spurt as well, okay? This is the Tanner stages in girls. This is how we know where the body changes are at. So this is a child that's still, hasn't had any body changes, and this is pretty much how you classify an adult. Okay, so you could have a 11-year-old here, you could have an 11-year-old here. So it all depends. It all depends. Each child is different. Okay, so let's talk about periods. So usually the period is going to start around 18 months after the breasts start developing. That's the average, okay? So, a lot of parents worry, this is, I see kids and, parents are like, oh, her breast started developing, she's going to have her period soon. And, I tell them, relax, it's coming. But, so 18 months is the average, okay? Whenever you have your IEP meetings at school, you should talk about what's the period policy at school, what's the menstruation policy. So this varies by district. Some schools don't want the bodily fluids, and I know that sounds weird. I'm telling you, I read this, and some schools do not want to deal with the whole blood, is it and all this, so they want which doesn't make sense. I know,
so they
but
let the kids go to school?
some.
Can't take care of themselves?
Yes. So some schools, and special needs kids. I'm not saying, this is something that, it doesn't make sense, but I'm just telling you that to talk about it in the IEP, who's going to help your daughter with her period management, okay? And it doesn't make sense, I agree, but you know how it is. The period hygiene. So, there are pads. If your daughter is wearing a diaper, a lot of parents recommend putting a pad in the diaper just for easier management. It's bulky, but that's what parents have expressed more success with. And then this is something that I put in, and I thought was cool when I saw it. I thought of our girls. There's period underwear, so it's. I thought it was interesting. This is the I'll show you in the next slide, but these are 3 brands that I looked up, but if you Google period underwear, you'll find a lot of alternatives. And basically, this I think is a good solution for the period management for our girls. The Thinx is like it's the equivalent of of wearing 2 tampons, so some kids don't actually do not need pads or extra, stuff to help them with their underwear. These actually have pads So just think about this, and maybe it can help you with your daughter's needs. Definitely not no tampons recommended. Because it's just the whole idea. I think it's it can be dangerous for our kids. And if nobody knows that there's a tampon, there's something called toxic shock syndrome. And our kids can become pretty sick and in the ICU just because of a tampon. So definitely, I would not recommend tampons for our girls, regardless of where they are developmentally. This is the Thinx brand. What I was talking about, the period underwear. So it has several layers, and I think it's a leak and stain resistant support matrix that's got you covered. So just I'm just throwing it out there to see methods to try to help our daughters. So I thought it was a pretty interesting concept, and it's not in the developmental, it's not in the special needs market, because a lot of things, if you put this as special needs, then, let's say the price is like $30 for underwear. If you put it as special needs, it's going to be $300. You know how it is, everything in special needs, add 0 or 2 zeros to it. So let's not even tell them that we're even thinking about this, because then the price is going to go up, okay? I know how it is. I've been through that. Okay, so let's talk about the menstrual cycle. Let's go back to Science 101. Basically, this is what happens every month when a girl has her period. You have to remember the first 2 years in any teenager usually is anovulatory, which means there's no ovulation. So the whole menstrual cycle is going to be pretty crazy. Like, it doesn't make sense. It could be very irregular. This is what has been said is a lot of seizures occur around this time of ovulation, but it's not for every kid, and it as everything, it depends each case by case child. The theory is that when the progesterone drops, the seizures are going to start. But there's a lot of girls that are having seizures here, and it all depends. Some girls, it doesn't make a difference. So it all depends on your daughter, But the theory is here with ovulation. So, so basically, let's talk about non-hormonal period management first. So it's important to try to have a period and mood diary, and basically evaluate if the periods are having an impact on your teenager's life. Are they changing anything? Is it even possible to know what's going on? So you just have to try to monitor it as much as possible and see if there's any change in behavior, during this time. Is it influenced by pain or discomfort? Is she in pain? Is she having pain? Because sometimes we think, oh, it's the hormones. But maybe your daughter is in pain, because it's part of our menstrual cycles. So try to evaluate the seizure frequency and if there's any relationship to periods. As I said, some girls will have a clear relationship, others will not. And for pain management, the nonsteroidal anti-inflammatories, such as ibuprofen or naproxen, are going to decrease the pain and the flow. Naproxen is a good NSAID because you can give it twice a day. So, on top of all the meds we give our daughters and our sons, this is a good option to help with our periods. And, it's Aleve, all the commercial names, for naproxen. All right, and then this is a pain scale, for our kids that are not verbal, or maybe, even if they are verbal, you can try to show them if they're having pain, to try to monitor and try to see. So this is a pain scale to try to see where they're at. Okay, so let's say the non-hormonal management is not working. It's definitely your daughter is being affected and impacted negatively by her periods. So before we start hormonal management, we have to think about these factors. So for example, weight. Is your daughter overweight? So a lot of the hormones are going to increase their weight. We have to evaluate their bones and the fracture risk and mobility. So if your child is in a wheelchair, the risk of fractures and the bones being weaker are going to be higher. the anticonvulsant meds that our kids take are going to make those bones weaker, as I was talking before. So, this is something that we have to talk about when we think of starting the hormonal management. Anytime you're going to start somebody on any hormonal management, you're going to talk about any clots in the family, what are the risk of the clots in the teenager, any history of cancer. Is there a need for contraception? Is it just to help her with her periods, or is it also as a measure to help with birth control? And you're going to try to evaluate the teen's understanding of what this is, and and are they going to be compliant with the method that you choose? So hormonal management, the options out there are, these are all the options available. So birth control pills, the patch and the ring, it's very easy for them to remove it, so it's not recommended as an option, so we can just scratch this one out. Depot shots. The depot shots are given every 4 months. Since it's progesterone that we're giving, it tends to not help with, it decreases the bone, it doesn't let the bone build up adequately sometimes. So, this is not something that you're going to do long term. Okay, so depot shots, definitely not long term. And a lot of girls have, 49% of the girls describe a lot of bleeding with the depot shots. The other option is the IUD, which is the intrauterine device. So basically, it's a little device that you put at the level of the womb or the uterus, and it locally puts progesterone. And the implants, so implants also not recommended. Basically, this is one of the options is in the arm, but that's not recommended either because it has a lot of bleeding as a side effect. So the ones that most commonly are going to be used are the birth control pills, the depot shots, short term, and the IUD with progesterone. Okay. So the birth control pills, regular birth control pills. It's going to be 21 pills with hormones, and it's going to be different levels of hormones throughout those 21 days. And then 7 days, it's going to be placebo or sugar. So what happens is you take the 21 days, and then 7 days, this is the time when you're going to have a period, okay? So, so what we're trying to do with giving them birth control pills is to try to control when she's going to have a period, not like whenever you're not, when you don't have medicine, and it's having a negative impact on her, then you want to know when she's going to have her period. So these are the regular birth control pills. What's recommended for girls with epilepsy is to have a continuous levels of hormones. So basically, the regular birth control pills are usually not used. What's recommended is the continuous birth control pills. So, these are the ones available in the United States. And you see, it's the same concept, as I was showing you, here. So basically what happens is there's 84 of the active pills with continuous levels of hormones, and then 1 week of the inactive, okay? And that's when you're going to have the bleed, okay? So, you're going to have a period every 3 months, so, you're going to skip periods, and you're going to know when your daughter is going to have her period. So this is, a good method. And then these are the different, brands, and, some of them have low dose estrogen, some of them have increased, so you try to pick the ones that are going to have continuous levels, and that, if your daughter is being affected in terms of seizures, having a continuous dose might help her with her seizures. And this is not perfect, as everything, it doesn't mean, you're going to go now and say, oh, I want you to start this and then this is going to work for my daughter. No, as in everything in medicine and in life, each person is different, but this is one way of helping your daughter. This is the IUD with progesterone that I was talking about. This is Mirena, sorry about that, Mirena. And see, this is the size of the device. It contains progesterone, levonorgestrel, and it's released slowly over 5 years. And this is at the level of the womb. of the uterus. As in everything, there's risks. There could be infection at the site. It could come out on its own, and usually you're going to need general anesthesia for placement because in a regular office, a gynecology office, they'll put it in, and they do it as an outpatient procedure. But in a child, like our kids, we're probably going to have to put them for anesthesia because they're going to have to cooperate for the placement. So other concerns, if your daughter's on phenobarbital, primidone, or Topamax, usually higher doses of hormonal treatments are going to be needed. So what we talked about before, you're probably going to need, and sometimes what they do is they use combinations. They use different methods to try to improve and to try to get them to skip their periods. So this is going to be a little bit more challenging. Okay. The other concerns I wanted to talk about was early puberty. Basically, this is basically when the body changes occur before age 8. So that's what we define as early puberty. Delayed puberty is no body changes by age 14, or if more than 5 years have gone between the breast and the pubic hair development. So periods should occur by age 16 years if there were changes in the body. Okay, so those are pretty much what is described. So for considering options for your daughters, so you have to take into account the family situation, the beliefs. What are your cultural needs? At the level of your daughter, what's the intellectual and social level? Are periods causing an impact on her life? And the interactions with the medicines she's taking, and basically choosing, what will be the best for your daughter's health and quality of life. So those are the options that we're going to take into consideration. These are the references, and these are my kids. And this is Francisco with the purple shirt, and he's my son with Dravet. Thank you.